Hi, everybody, and welcome to our October Ambassador Briefing here. I'm very excited to have our special guest presenter, Dr. Wisit Cheungpasitporn is with the Mayo Clinic in Minnesota, and he is going to speak to us about AI. So without further ado, Doctor, I will turn the floor over to you.
Wonderful. And thank you so much, everyone, for joining today. And today I'm really honored to, show you the updates of how AI helping us, helping nephrologists as well as helping patients and families. So again, I'm Wisit Cheungpasitporn. I have a long name, as you see, the difficult to pronounce, and I have strong accent. If you have any questions at the end, I'm happy to the answer or clarify the each point that I'm going to move the forward. So I am a nephrologist at Mayo Clinic, and I am fortunate to be the part of AI steering committee for American Society of Nephrology. So we are the developing the statement and the our guideline to advance kidney care, how to do it to help our patients and family. So the as you already see on this slide that we have a lot of AI that already incorporate into the care for our patients.
Well,
The
actually, the slide is not showing now.
Oh, do you let me
No,
share my computer
it's showing
screen
on mine.
again?
Yeah.
Can you see my slide now?
Yes, I can see it.
Oh, okay.
Okay,
I can see
perfect.
it.
Okay, go ahead.
Excellent, very good. Thank you. So basically, you can see slide, right? Good. Okay.
Yes.
So we can see that we already incorporating the AI tools in our healthcare now that helping in caring for our patient for administrative work and also for the research. I'm going to show you the examples of what we already use here at Mayo and also in many the institutions in the US already. So as you know, the that we used to say that when you see us in the clinic with the doctor, in the past we needed to like the write down or type in about what we discussed, but now we having AI that listening to our conversation. We call ambient ambient AI that help transcribe, record the conversation, and then transcribe into the medical notes. So then we can focus on caring for you, for our patient, for the patient family, without the need to be worried about the the documentation that we need to the work on after visit or even like after hours. And from what I the want to show you is example of one of the AI that for when we seeing patient in the clinic, the we have AI that listen to the conversation and generate documentations for us, and we already been using it the at Mayo and also in many institutions the in the US, as you see, not only Mayo Clinic, but many the hospitals already employ the this AI. So let's say when I'm seeing patient in the clinic, I have my phone, and my phone is the basically the Mayo Clinic secured. So my the phone the data that the I use in this application will secure in this application and not leaking the information to elsewhere. So you don't need to be worried about the data privacy that the conversation that we record or the AI record will go outside because this is the secured under the institution. And also the AI censor and remove the information that not relevant. For example, when I talk to the patient, I usually like say, "Oh, how's your day going? The how's the weather is like? Uh, in Minnesota, it's like always like snowing in the winter. It's always cold. The something like that." When we talked about in general, those AI the censor the information that's not relevant and just focus on the uh, the visit and the clinical problems that we solving and helping the patient. So you can see this example of the phone, and there's a medical record that the application that we choose, and this the schedule how our doctor like physician the look like on that day and have like the patients. But of course it's not the real patient. I changed the name, so this no confidentiality the problem. So let's say the I click on one of the encounter, and there's the AI the record button that can click on and then listen to our conversation with the patient and turn the to be the note. And you can see that there's a note the written out the right away after the visit. And this is the important the for us, because first of all the in the past doctors spend a lot of time writing down the and rush the the we don't want to rush, but as a human, we needed to the finish these notes as well, and we spend a lot of time, even like after hours, to work on these notes, and instead of focusing on caring for our patient, the so this help us the to reduce the doctor the documentation burnout the or burden, and focus more on our patient. And also the notes are the well written, that the patients can understand better as well when you read through the this note. But of course, when you're done with the note, it's the still the doctor responsibility that need to go over this information and make sure that those information are accurate. The so this is an example of the patient instruction after visit. So the in the past, the doctor or patient and family need to write down what you need to do. The after visit sometimes it's like really long visit, and then at the end of the visit you cannot remember the what you need to do. So nowadays, the after the visit, I just the put the generate the instruction, and you can see this example of the instruction that generate by the AI. That okay, we talk about your kidney transplant list. We talk about how much urine you're making. We talk about how your blood pressure today, what we should do, the and about the labs and what we should the watch for the future. So you can see that it's written down very nicely and generated by AI right away. And what I like is I the review and print out to the patient and family right after the visit. So then you can review this the and remember the what we discussed, and this is for the better care for our patient. And also the not only the medical record now with the inbox messages as well. So you may be familiar that the in our the electronic health record, you can send the messages to the doctor or the care team, and we review and send the message or reply the message back. And I need to say that the as a the aspect as a doctor in the past, they are like, and still we have a lot of messages that the come in, and it's hard to the review and reply them all with the all the messages that we receive. But the needs of the patients come first. We need to go over that. And in the past, like before we have AI incorporate in our the messages, the management, the I used to spend time until midnight to reply messages, the which affecting the my my sleep, my the plan for tomorrow that I need to care for the other patients that also deserve the best care. Every patient deserve the best from us. So the message the that we receive are a lot, and we need to handle them, and we want to help the you all as well when you send the message. So now we have the AI that help the review the message and generate draft for us. So you can see this example again. This is not the real patient. This is the my sister, the name and picture at her permission. So the I send the patient message. We got the message. AI generate the message reply for us. But at the end, I still review of this message, and then the draft, the reply, to make sure that you get the best answer and correct answer based on your care. Which is this is helping us a lot because the we don't need to type the like the all of them, but we can at least have draft that generate to the message that you need, and then better care for the patient. So basically, don't feel that, oh, you're talking to the AI behind the scene. You still have us, doctor, that review and customize and make sure that this message that's sent to you is accurate. Okay, but it's helping us to save more time so we can the communicate the with you all faster, the better communication and maintaining trust. Okay, so the next AI that I want to show you is about record time. So, which is the outside medical record. So think about this, that, when you come in to see us in the past, like 5 years ago, you brought in the outside medical record, like the whole big, like, folders or like 100 pages of outside medical record. For us as a doctor, it's so hard to review 100 pages the like within 5 to 10 minutes and then giving you the answer, or the it's also the better care for you all too, to like that we can access those medical record before time, so we can review your medical record, what happened, and giving you the best the answer that you need. So with the electronic health record, now we have what we call care everywhere. That if for example, Mayo Clinic, we use Epic electronic health record, and if your the hospitals that you see doctor outside also have Epic, we can request, and you can give permission, and we can see what's going on at outside or different institutions that use Epic. But let's say if the your institution don't use the same electronic health record, now we have AI that can process those, like scan medical record, or the medical record that you gave us like 100 pages, and we scan them, and AI the change the format from those PDF into the the text that we can go over the medical record quickly, and summarize the medical record quickly. So for you all in the future, it's gonna be better care, that we can process the outside medical record faster as well. Okay, so this help your care team to be able to complete accurate information faster and safer. Okay, so now blood pressure, uh, we starting to incorporate the home monitoring. So for example, at Mayo Clinic, like you can enroll into the what we call home blood pressure, the monitor, and if you have a blood pressure cuff or blood pressure machine that the certified and the the like fit in to integrate to our electronic health record is can Bluetooth and give the information through the our system, and you can see that we can monitor your blood pressure even you at home and have this information, and we have our nursing team to review of this blood pressure and giving you the prompt the advice uh, that the better care for you at home, right? This is the example of the our care here the in the era of technology, new technology and electronic health record. For the questions, medical knowledge now, nephrologists and clinicians have much the better the tools compared to in the past. Imagine the 5 to 10 years ago that we needed to like open the textbooks, right? When we see the patients that complex, and we as a doctor the nobody can remember all the information, and we need to find the information that is right for you. In the past we opened the textbook, the after that we the open the articles, the journals, right? After that, we have the what we call up to date that we can search the information, right? But now we have AI that the develop to answer the medical questions that call open evidence. So open evidence, we're gonna talk about what is open evidence in the next two slides. But as you know, the that patients nowadays or the myself to answer some of my personal questions. Sometimes I like, oh, I want to eat this. Do you have any food? The suggestion, or the I want to go to travel this to this city. What your suggestion is, right? So we ask many questions to the AI or ChatGPT large language model all the time, right? But as a patient, the you may do so, but you need to keep in mind that the answer is not always accurate, right? We call the inaccuracy is as the hallucination, right? So this is the paper that we published in CJSON, which is a high impact, the journal, American Society of Nephrology. We show that our nephrologist, the examinee, still smarter than ChatGPT, right? But at that time, ChatGPT was ChatGPT 4. Now we have ChatGPT 5. We don't have the data yet on the performances, but based on the GPT 4, the our nephrologist human still smarter than the GPT, right? We know how to improve the model, and we know that ChatGPT is not the fine-tuned to answer the questions from nephrologists or from the internal medicine. So we fine-tune the model and have the AI that develop under the Mayo Clinic platform that call open evidence. And now doctors the around the US and some countries the outside the US, such as Europe or Canada, can also access open evidence as well, so it's not limited to the US. But right now it's limited to the physician and advanced practitioner things may change in the future. Right now, the patients or patient family cannot use it yet because it's required the license. But the in future, the things may change. For example, when I have a question about medical, the question I don't the you know I don't look at the internet or Google, right? I put into the AI, and I see the answers to confirm the my thought process. And how can we the confirm that this answer correct? The this AI also giving us the references, and you can go into the references to make sure that the resource that you got from the knowledge is accurate, and that what you really want. Okay. The and to say that we also can use open evidence to uh, do the medical appeal letter for us. So we use I use this very often nowadays now to get the appeal for the medication for the insurance to approve the medication for our patient, because the need of the patient come first. Of course, we don't put the patient information like the personal information in the AI, unless it's under the secured platform. We used to generate the letter, and in the past, the with the patient care, we really did not have time to generate the letter, because one letter it took for the a doctor to generate letter at least a half of hour, and we don't have a lot of time for that with our clinical responsibility. But now with the AI, a letter can be generated less than 2 minutes, and that is good. This is example of the me doing appeal letter and the prior authorization for our patient. And you can see that the with us that using the AI in the great utilization, we can approve patient to use SGLT2 inhibitor. We can get patient approved to use the semaglutide or GLP-1 receptor agonist to save the kidneys. And you can see, as a doctor, as a nephrologist, at the end of the day, this is like my happiness to see the that patient the got what the patient really need. And more, we also have other AI incorporate in electronic health record at Mayo Clinic. So for example, the EKG AI, we already use it for the patients with heart disease, including the kidney patients as well. In our electronic health record, when we have EKG, there is an AI that able to tell us the probability of the atrial fibrillation, the probability of aortic stenosis. Another day, I had a patient that had EKG and it's asymptomatic and had the high probability of aortic stenosis, and we catch this early and optimize medication early. So that is better for the patient. So I'm going to finish in the several slides, but for the kidneys, you can see that now we have the AI to help us the to help solve problem and summary the messages and documentation faster. It's still the human, it's still doctor that giving you the information. It's not AI. So the doctor and human still the be responsible to the care, the not replacing your doctor. And in the future, for the 2026, right now, American Society of Nephrology, we already built the team for AI steering committee. The and our the AI statement going to be released soon. And also, as you know, we have the American Society of Nephrology Kidney Week next week in Houston, Texas, and we're gonna learn more and understand more about the how to advance AI in care for our patient with kidney disease. The in more the details, and we will know more how to build the group and provide the better care for our patients. And also you may hear the about KDIGO, which is the guideline for our the patients with kidney disease. KDIGO going to build up the guideline and the team, and I'll be part of the KDIGO group for AI that going to have the meeting and the brainstorm the about AI for kidney care in the Spain the at the end of November next month. So we will continue to advance and using AI to help us for caring for the patient. And if there's any question, I'm really happy to answer. All right.
So I'll say one question that someone emailed me that they weren't going to be able to make it, but they wanted to know if doctors are currently using or could be using AI in the future to just scan regular results and stuff that might flag kidney disease or warning signs for kidney disease that a physician might not always have front of mind.
Right. So the the very common the things, and nowadays patients can also access the medical record, right? So when you the have labs and medical records, if you have like my chart the or the patient portal, those results also the coming to you, so you can see those results. But most of the time when you look through those results and they are red color, and then you like, oh, what is this, what does it mean, the and then you can communicate. The workflow is that you communicate to the doctor, or the doctor get those results and communicate to you, right? The so in the future they will likely, you know, be that when you get the result, or the result being processed by the AI, and AI the you know giving the result to the doctor to confirm and share with the patient, right? So
Mhm.
that is the still we still want to keep the doctor and patient the communication and relationship. We don't want everything to be automated and generated by AI and just sent to the patient, because as you know, AI can make mistake, doctor can make mistake too. The but AI and doctor, the we are hoping that will make less or least or no mistake and better efficiency.
Well, thank you.
I have a question for you.
Yes.
My son has had actually two kidney transplants already. His kidneys failed in 2013 due to high blood pressure when he graduated from Penn State. At the time, we trained for and went on to home hemodialysis, and we had to do paper flow charts and turn them in on our monthly visit to our nephrology office. The second one time that he had to go back on dialysis was in 2022, and that was following failure due to COVID and pneumonia. But when we went back on dialysis at that time, he was provided an iPad, and that iPad transmitted real time the dialysis treatment that he did, as well as the blood pressure readings. Was that when he did that way, was that artificial intelligence doing that because it was transmitted back to his nurse manager at the nephrologist office or at the dialysis center? Could that have been considered AI at that time?
That is likely consider the one of the output from software. The but we can say the it's from we can say part of that is AI. but more of from the software generation. And nowadays, there are many the AI include so many things. Large language model is part of the AI, but AI can be AI automation, or like when the watching Netflix and say Netflix recommend you the next movie that you should watch. That's also part of the AI. You
Mm-hmm.
driving the Tesla, that's also the AI. So there are so many things that can consider AI. And what you're saying is the also part of the AI. What we hoping for the for the dialysis that we hoping for is that the nowadays there are the AI algorithms that help the manage the like anemia. So for example, like when you get the hemoglobin, like this number,
Mm-hmm.
the and what was hemoglobin last month, and how much the erythropoietin stimulating agent, like for example, Aranese or Epogen that you get in,
Mm-hmm.
and how much the iron the how you have, and then AI help the generate the protocol or
Okay.
the dose of the medication that you need, right? So that is one of the what we the working on. What we also working on to incorporate, for example, the dialysis. The you may see that it's very common that some patients have the cramps or have low blood pressure at dialysis, and
Mm-hmm.
the how to prevent those, and what we should do to the prevent hypertension or cramp. So that is also very likely going to happen in the future, or the soon, because we already have those algorithms. We just need to incorporate into the workflow. And
Mm-hmm.
for the kidney transplant, for example, there are lots of the efforts that we now using the AI, the workflow to help with the allocation. So hopefully the it will be the equitable, and also the faster or more efficient on the
Mm-hmm.
matching, and how to get the kidney the like match faster for our the end stage kidney disease or dialysis patient, right? Or
Mm-hmm.
even like the AI can also help the with technology for the development of possible future wearable dialysis, that they have been ongoing efforts to do that. The technology is advancing, so
Mm-hmm.
that is also possible for the future. Or as you may hear about the xenotransplantation, that the pig the kidney transplant, right? Kidney transplant from pigs. So those
Mm-hmm.
also still like advancing. So the AI help us, has a lot of potential to help us on this advancement faster.
Mm-hmm.
And also as you mentioned that the in the past, like your son got the labs every month, right? And then sometime it's also there was some delay on getting the tacrolimus level result, how to adjust it. The Now we also have ongoing efforts to use AI to just the adjust tacrolimus and tell you the like the real time that okay, this is your tacrolimus level, the prograph level, and how much you should the adjust or increase. So those will help increase the efficiency care for our patients. But of course,
Mm-hmm.
this will should be the under supervision by human.
I see. Well, post-transplant now, they do actually, when he has his labs done, contact him after they're reviewed to adjust the tacrolimus, like you were
Mm.
saying. But there's no more flow sheets when you're doing dialysis because it's transmitted real time, and they can adjust those medications sooner rather than waiting until you see the doctor at your visit with paper flow sheets.
Right.
It's really has changed dramatically in that regard. That's what I noticed, the evolving. That's why I questioned whether it would be artificial intelligence intervening there.
Very, very, very likely that would consider artificial intelligence.
Mhm. Thank you. Thank you very much.
You're welcome. I see
We have a
Cecily.
question. Cecily, you can go ahead and ask your question.
Thank you. Thank you, Doctor. Wonderful presentation. I always get so excited. I guess
Thanks.
I just wanted to understand a little bit more about how we're making sure the care still remains accessible, and that AI is great. It's moving at lightning speed. It's, kind of, ingraining itself in everyday aspects of our lives. But, some patients still are struggling with that. And how do we maintain, that we don't leave people behind?
That is really excellent question, and this is the answer that the solution is very challenging, but we will do our best to make this the accessible and equitable for everyone. We can see the example of, like, for example, I have the home dialysis clinic on another day, and the one of my patients is on the peritoneal dialysis, but the lives very the far away in the what we call middle of nowhere, Rochester, Minnesota. If anyone visit before, it's very small town, but we have
Yes.
Mayo Clinic. It's
I know
really
Minnesota well. I went to University of Minnesota, so I know all
yeah.
about Twin Cities, Rochester, all that area.
Yes, Minneapolis is a big city, but Rochester is small. The town or small city, but we have wonderful Mayo Clinic here. So but we have the patient that in the kind of like middle of nowhere, far out, the which have very limited the signal and no the great network at all, and then the data that transmitted from the machine, peritoneal dialysis machine to us, the very very the limited. So the for some patients that have great network, I can see how the peritoneal dialysis run at home, but some patients that have limited network, limited access, they are limited data, and then that may affect our care on how we adjust peritoneal dialysis for the patient. So we are finding the solution, like how the to make that the better, like better network, or do we need better technology to the detect those the changes that we looking for, or we should have like backup plan on how we do when there's a limited the network. So we want to make sure that not only the patients who accessible to AI will get care, but the patients who have limited access or limited the resource from the AI, the will also should get the care from us the best as we can as well. So this is the difficult question, the Cecily, but we working on it, and one of the questions that we will address as a steering committee group in the KDIGO meeting next month is also equitable AI. So even I cannot answer that today. We as a whole group of the AI steering committee will do our best to make AI equitable.
But I'll ask one last question here, because I know we're over on your time. But do you think the AI feature will eliminate the need for scribes moving forward? Because the person who submitted this said they always thought it was a good learning opportunity for residents who might not be really learning much about the kidney field? And also, so I guess second part is, how do you deal with folks who are not comfortable with AI and feel that their info being recorded or transmitted is not in their best interests?
So the now is very the like I would say unavoidable for doctors to know AI. I would say that in the past when we move from the documentation writing record to electronic health record, they were like senior doctors that did not want did not want to learn or did not like the change, retired. But we advancing anyway with electronic health record. And now with the AI, when we started using AI, many the doctors like pushing back but we can see that it's not only the healthcare, but all the companies, the world moving forward with AI. So I would say the skills in using AI or learning AI is unavoidable, is the important to know. That's why the AI education now is emphasized here at Mayo and also in many medical school already. I am part of I am a AI content curriculum director for Mayo Medical School, and we developing curriculum the about AI in healthcare. So our the medical students will learn how to use AI the ethically,
Mhm.
safely for better patient care at the second year of medical student. So we also now the incorporating the AI education for our nephrology fellow as well.
And so, how do you deal with patients who aren't comfortable with a doctor using AI?
I respect the patients because the even we every time when I use, for example, I use AI for documentation, I ask the consent first. I always ask consent like that. Okay, I'm gonna use AI to help documentation, and I show our patients that this is under the Mayo Secure the privacy, so your data is not leaking the but the of course there's some patient that don't feel comfortable, so with that I use the basically the 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 style that I used before, which is the just the typing writing but not using AI. So we still respect the patient and the follow patients the request, but the later on, very likely, the moving forward, when the future is evolving, the consent will likely come from the whole organization. For example, if you come into that the hospital, that hospital may disclose or declare at front that okay, we are the hospital that utilize AI. Are you accept this or not?
Mhm.
Basically. But the as a whole organization, we need to show you that we're doing this safely and there's no leaking in the patient data, and we're doing this for you, for us, for the best patient care. But to answer your question, Ben, the needs of the patient and the come first, and we respect the patient privacy.
Well, thank you. And Dr. Cheungpasitporn, I'd like to thank you for your time today. Like I said, I know we took up more of your time than was expected. So thank you. And
You're
it's
welcome.
been an invaluable resource for us today for you to share all the info. So thank you once again.
Thank you so much for having me. Have a wonderful rest of your day.
Thank you.
Bye.